Cancer survivors, you know better than most that when it comes to cancer treatment, even when it's over, it's not necessarily over. So welcome to the Recovery Room. I'm cancer physical therapy specialist, Dr. Leslie Waltke. And in this episode, we are talking about female cancer survivors and sex. Treatment side effects, surgical side effects, hormonal effects, scars and body image. That is a lot that affects you and your partner. So today we are talking with Cancer Nurse Navigator and breast cancer survivor, Laura. Hi, Laura.
Hi.
How are you?
Good.
She's going to help us unpack this really delicate and very, very important part of cancer survivorship. So, Laura, tell us first about how these side effects and all the side effects that can impact a woman and her partner.
So I think the first thing to keep in mind is that cancer does affect every aspect of your life, and your sexual health and your sex life is no different. And it can affect your sexual health as you're going through treatment, but also for years after. And it can do so in many ways. Physically, it can affect your pelvis, your vagina. It can affect your ability to have orgasms. It can cause pain during intercourse. It can cause body image issues.
So when it comes to painful intercourse, are there some things that people can do?
Absolutely. And there's a couple of different reasons why women might have painful intercourse. One of the primary reasons that is associated with menopause, and it's also associated with these anti-estrogen medications or even pelvic radiation, is vaginal dryness. Mm-hmm. And some simple things to start to try is absolutely using a lubricant during vaginal penetration. Mm-hmm. Sometimes that's all that a woman needs, but many times women will need more. And that's where vaginal moisturizers come in. So,
and is that something you use like continuously all the time, or just before you know you're going to have sex?
So vaginal moisturizers are akin to washing your hands and putting moisturizers on your hands. Okay. So it's something that you do continuously, and it's kind of like a maintenance thing. There's different products out there. So some include applicators that you apply, every 3 days. Some are kind of in a larger bottle, and you apply into the vagina with your fingers or with a massaging wand. And some you apply externally to the external genitalia.
Okay. And where does somebody get that stuff?
Well, with the beauty of the internet, you can get that on Amazon. Absolutely. You can get it at shops that specifically sell sex toys. Yeah. The people that work at these shops are so knowledgeable.
Yes.
They are amazing.
Yes. And don't be embarrassed to go into those places. They're spectacular.
They are spectacular. They know so much information, and they know exactly the problems that you're dealing with, and they can really point you in the right direction. Another good source of information that specifically talks about moisturizer and lubrication is a website called sexualityresources.com. They have a ton of information online that is available and free for people to access.
Okay. But there are no concerns at having sex during cancer treatment or early afterwards, correct?
Correct. If you start to notice that you're having some pelvic pain or extreme pelvic dryness, that's where pelvic floor therapists come into play.
Yes.
This is a specialty of physical therapy.
Physical therapists are awesome, just saying.
So talk to your doctor if you are having pain during intercourse, if you're having extreme dryness, problems with vaginal atrophy. Get an order for pelvic floor therapy from your doctor. It's physical therapy, it's covered by insurance, and they will help you immensely.
Very good. And I also want to say, too, that intimacy during cancer treatment, when you're fatigued and you feel crappy, sex doesn't always have to end in orgasm. Okay, that's not a success point. So just cuddling and holding and kissing and massaging and stroking, that's all good stuff, and it's very healthy for both you and your partner. And I think, too, that partners need to realize that they're not going to hurt you, because sometimes they are. They're not going to get sick from the radiation. They can't catch the chemotherapy. They're certainly not going to catch your cancer. But he or she needs to know that they're not going to cause you any harm. They're just as afraid as the patient is often.
Exactly.
So communication is really, really important. So can you talk a little bit about communicating when either during or right after treatment?
Right. So communication with your partner is so important, and this is really difficult for many people because a lot of couples don't really talk about sex.
Yeah.
But this is a time when you really need to start the conversation. confusion, for misunderstanding, for making false assumptions about what the other person's thinking, unless you do have that conversation. So write down what you're feeling, what your concerns are, what you think maybe the other person's concerns are, because maybe you're thinking they're having a problem and they're not. And
Right.
but having that piece of paper while you're having the conversation, setting aside time to have that conversation, when it's when you can be alone and when you can be quiet and you can really be present. Sometimes people do need some extra support in having these conversations, and so some people will go see couples therapy. There's also a specialist of therapists called sex therapists or sex counselors, and they are available, and they specifically deal with people who are having issues with their sexual health, their sexuality. They help couples. They can be a great resource as well. If you go online and search for sex therapists or sex educators, there's a great website that can help you find one in your area.
Okay, so I will post those websites in the comment section or in the description section so you have easy access to those. So, sex is important, whether you're single or whether you're partnered. And it's important for you and your partner. So, thanks, Laura. That was awesome. Let us know in the comments section if you are having issues. What are your other questions? How are you feeling about this? And please share this information so others can be helped as well. I'm Dr. Leslie Waltke and Laura signing out from the recovery room. We will talk again soon.